the Healthier Together programme is not just a website, it's an ethos about how we take those professionals on a journey with us.
And it's taking away that awful worry that you're missing a serious illness.
This isn't about illness, this is about maintaining health. This is about advocating for prevention and early interventions.
Hello and welcome to the Peds Round. The Peds Round is a regular podcast from the Royal College of Paediatrics and Child Health, and we touch on important topics in paediatrics. And we aim to bring you up to date and talk about relevant educational points for your practice.
Hello and welcome, and this is an episode of the Peds Round. My name is Emma Lynn and I'm a paediatric consultant in the north of England in Newcastle upon Tyne, and I'm here with my trusty sidekick, Christo Tsilifis. Do you want to say hi, Christo?
Hi, my name's Christo and I'm a paediatric trainee working with Emma in Newcastle.
And it's my very great pleasure to have a fabulous guest with me today. It's one of my dearest and oldest friends, Sanjay Patel.
I'm a paediatric infectious diseases consultant based down in Southampton, and Emma and I have known each other for about 15 or 20 years, having worked together in London many years ago.
So Sanjay and I have been working on something that I am really passionate about, and it's called Healthier Together. And for me, I think the secret to this is I really believe that knowledge is power, and that sharing information and sharing health information in an equal way so that everybody gets to know as much as possible is the key to this. But at first sight, Healthier Together is a website about health information for children and babies, maternity and young people. Sanjay, how would you describe Healthier Together?
You know, that's a really good question, Emma. And I think at first sight, people do think it's just a website. And yeah, I call the program the Healthier Together program as opposed to the Healthier Together website, because actually what it's trying to do is empower parents and young people and pregnant women. And the reason we set out on this journey, over 10 years ago, was just a simple observation that a lot of parents bring their children to the attention of a healthcare professional because they're worried about their child. When you look at kind of rates of pathology in children compared to, say, the frail and elderly, a lot of our management is managing anxiety. And obviously within it are a small number of desperately unwell children who do need to be seen quickly. And they often come to our attention eventually, don't they, Emma, in our role as PEDS ID consultants. So I think that was the original observation. And then when you look into the literature about why that sort of health-seeking behaviour has occurred or is occurring, a lot of it is to do with confidence. And confidence is such a fragile thing, as we all know as clinicians. In order to be a good clinician, it's all about feeling confident. And it's exactly the same for parents. I think clearly society has changed over the last 10, 15, 20, 30 years. And parents are the first to admit that they just don't really know when their child's poorly, when they're unwell enough to need attention, and when they're really, really poorly to need to go to hospital. And when we look at all the data that we have, there are so many children being brought to ED and primary care. And I think that's what we're trying to address, consistent messages.
I absolutely agree. And I had this really interesting conversation with one of our healthcare associates who worked in the community, and we were training everybody to use the Healthier Together project. And she said, I'm one of those people. I'm really anxious. I'm a serial emergency department attender because I sit at home and I worry and worry. I can't trust myself and I need to go and find somebody else's opinion. She said, since I've had access to this website, since I can cross-check with my own worries, I've actually stopped going so often. So for me, that's the key to this. It's that parental anxiety. It's empowering parents, and it's taking away that awful worry that you're missing a serious illness. And you and I know that actually, of all the children we see, the ones with serious bacterial infections are like 1%, 1 to 5%. So they're the very, very few.
So that's a fascinating story, isn't it, Emma, about an individual whose health-seeking behaviour has been so radically transformed by access to these resources. And when we've looked at this at scale, and we've looked at it across Hampshire and the Isle of Wight, we've seen similar trends for primary care presentations and for ED presentations. I think for me, one of the aspects of health-seeking behaviour is the negative impact we can have as professionals. We generally think that we bring added value all of the time by how we communicate with parents. But I think when you look at how complex our urgent care system is, if parents are faced with inconsistency at the different points in that system, and if they see a GP or a practice nurse who tells them one thing, and then they go on the NHS UK website and get something else, and then they call up 111 and they're told, God, you need to take your child to ED, it's impossible for them to trust their instincts. And that's why the Healthier Together program is not just a website. It's an ethos about how we take those professionals on a journey with us to ensure that we are consistent in what we communicate with parents, because I think that that's going to be the game changer in terms of parental confidence.
Absolutely. I think that's so important, this idea about consistency. I see it all the time with different advice about weaning, different advice about cow's milk protein allergy. And I think when you go onto the website, there's two things. First of all, you can see an area for parents. You can see an area for young people. So they don't necessarily want the same information as their parents. And you can see the professionals' information. And it is completely transparent so that a parent can go and look at the professionals' information if they want to. And lots of parents do a lot of digging around on the internet. And they do like to see, I often say to them, if you're the sort of person who likes to read a lot on the internet, have a look at our professional site, see what they should be looking at, see why they think you should go various places, because it's all transparent. And the other new addition to the Healthier Together program is an app for your phone. And the great thing about an app is first of all, it takes out some of the unnecessary information. So if you put in your details for how old your child is, you will only look at the bit that is relevant for that child. If, for example, your child is, let's say, coughing, you can then put in their symptoms, their coughing, and you will be taken to the page on coughing. It will ask you some questions, and the questions will then rank your child's symptoms into that red, amber, green categories. So red is obviously bad. Red is you need to go straight to the emergency department. The amber category is the grey zone. And that is where you might need some health information or advice from another professional. That could be from your GP. It could be from 111. And you are automatically linked to your GP, and your GP could then email back some advice to you. If you don't have any red or amber flags, as it were, it doesn't mean that your child is well, but it does mean that your child is safe to stay at home, and there is some simple self-care advice. For example, taking paracetamol, not wasting money on cough medicine, which is one of my bugbears. So, Sanjay, tell us a bit more about how the app works.
Yeah, the app is the newest addition to the Healthier Together program. So if we think about one arm of the program being the website, that's clearly quite static information that's one directional in terms of we can put content on the website and people read it. We obviously base lots of our training of professionals on the content on the professional site. And so almost the key to embedding the Healthier Together program anywhere is to ensure that all of those professionals, from our voluntary sector colleagues to our health visiting colleagues to primary care staff to ED doctors, etc., that we're all consistent. But then the newest bit is the app, and the app really takes into account functionality. We're also used to using digital technology. We use it for banking. We use it for everything now. That the app is more intuitive in terms of displaying the core information the parents want, and that's the red, amber, green content. But in addition, it's functional in terms of integration with primary care and NHS 111 potentially. So in Hampshire and the Isle of Wight, if a child in working hours has amber features, the app will send a message via the app to the GP practice. The GP practice will review that information the same day and communicate with the parent. Out of hours, it links up with NHS 111, and so you get a similar functionality.
I know also, Sanjay, you have this master plan where from sort of conception to 19 you'll be linked to Healthier Together. So down south you've actually done a lot of work embedding the maternity app into this. How does that work?
Well, we all know that improving pregnancy has such an impact on childhood outcomes, and we have a really captive audience with pregnant women, as anyone will know. When they're pregnant with their first child, you're desperate for information. And so we worked really hard with our midwifery colleagues, and this work has been recognised by the Royal College of Midwifery in terms of their digital award that they awarded the app earlier this year. And it provides very similar functionality to the paediatric app, that when a pregnant person is worried during pregnancy, they can access resources easily, and they can integrate with the maternity desk that we have in Hampshire. And so it really means you get the right information in a timely fashion. And looking at the data we have from the maternity app, most of the requests and information seeking by pregnant women results in reassurance and no need to progress that to further discussions.
So, for example, you're pregnant with your first baby, you might be worried about less fetal movements. You can go onto a page on the app, check out if it's okay, get a response from a trusted professional, so a midwife or your GP, and then be reassured. And that would save people from actually making unnecessary visits. And you've got some evidence to show that the app has actually reduced visits or reduced attendances. Is that right?
That's right, Emma. Yeah, we've got evidence to show that it's reduced visits to GP practices, and that's the data we're getting from our GP colleagues across Hampshire and the Isle of Wight. And we're just getting feedback from pregnant women that, for many of the things that worry them, similarly to parents with children, that they find the content very reassuring and easy to access. And I think the real strength of the maternity app actually is that not only do they create a profile for themselves, but as soon as their baby's born, they create a profile for their baby and other children in the family. So it's a very powerful way of having parents creating profiles for their children. So I envisage in the next 5 years, every child in Hampshire and the Isle of Wight will have a profile on the app, because every pregnant woman in the past year has created a profile for herself.
There's one other thing that I really want to talk about. I think that you and I know the kind of people who look on websites and apps are often well-off people, they're educated people, they're hunting for more information, they've got a laptop. So it's second nature for them to look up health advice and be able to judge what is good and what is not good. But how does Healthier Together help the underserved communities? How is it there to provide a leveler for health inequality?
I think that's the $1 million question, Emma, and I think we've spent a lot of time thinking about that as part of the Healthier Together programme, not just with our site in Hampshire and the Isle of Wight, but with many of the other 15, 16 ICSs that have onboarded with the programme. I think it goes back to the initial discussion we had about Healthier Together not being just a website, but being an ethos, being a way that we can integrate care. The pendulum swung so much during COVID towards digital offers, and I think we're increasingly realizing that that's not the answer. You can't do everything digitally, and you can't deliver healthcare entirely digitally. We have a myriad of extraordinary people that deliver healthcare, from volunteers to health visitors to midwives to primary care staff. And actually, in my view, Healthier Together is just a platform to support those individuals. And so it's not about having access to a website. It's how those individuals can be empowered to better support those families, because those are the professionals and volunteers that go out to support the most vulnerable families. And I think, and a thought I've had recently following discussions with the Department for Education with NHS England is that the siloed working that we're forced to work in. We work for the NHS, so many of our thoughts relate to NHS pressures. But when you speak to colleagues from the Department of Education, their pressures are to do with school attendance and school preparedness. And when you actually think of the children that you've described, who are these extremely vulnerable children? They're the same families, the same children. It's the same child that's not attending school, that's potentially got safeguarding issues, that's potentially presenting to primary care or ED multiple times. And so I think we need to change our approach to delivery of care away from siloed working to patient-centered and family-centered approaches. And I think that's where Healthier Together can really win. I think it offers a platform that teachers can buy into, that social care staff, including local authority staff, public health staff, health visitors, they can all buy into, and healthcare professionals can buy into. And so that's where I see the vision of the Healthier Together programme supporting the most vulnerable families in society.
Yeah, and I think that's something that we not really talked about, that it's not actually just specialists like ourselves or GPs who have done so much work in building this site, but it's actually how this site is used out in the community. So we have a champions program, because I think you're right. People don't want digital information all the time. They want the information from somebody they trust, and somebody they trust is usually somebody in the community who understands what it's like to live and work in that community. So up in the Northeast, we've developed a champions program where we had special training for people in the community. Some of these were non-governmental organizations, parent groups, schools, and they would all come and get a bit of information. And then they would go back to the community and they would then champion the Healthier Together project to their community. It's very interesting you picked school attendance. We had a really good feedback from one of the schools. We have a really great page which shares when your child can go to school. So, for example, if you have diarrhea, you have to stay off for 48 hours. If you have NITs, it's bad, but it doesn't mean you can't go to school. And they had some children who weren't attending quite a lot with things like a little cold. And they sent them the page and they said, every time they're sick, we will be looking against this page. And the parents actually really found it very reassuring, and that child's attendance improved. So that's a very real example of how information on the site ended up with better school attendance for a child.
I think your point is very well made, Emma. And what we've realised, all of us as healthcare professionals, or just as members of society that care for children, is that schools are hugely protective. And so although we perceive school attendance as a kind of something outside of our sphere, we know that when children don't attend school, they lose their most important protective mechanism, especially for their emotional well-being and mental health. And so those same children, if we don't focus on school attendance, will end up coming onto our wards with eating disorders and self-harm and altered behaviour. And so this is an us problem. It's not a them problem. It's not a DFE problem. It's anyone who wishes to advocate for children and support children needs to recognise we need to work together. And so I think the model you've described of social prescribers or health and well-being champions in community settings is exactly the right model to go for. And it's something we're working up with the Well Centre, which is a charity in South London that have sort of used that model to support young people. And I think that's a model we should be advocating for across the country.
Absolutely. There are quite a few great examples. So I think in Liverpool, Ian Sinner and Alice Lee had parent centre hubs where they used the same kind of information to teach the local community. So they taught people in the local community about bronchiolitis, and they had bronchiolitis champions, and they showed that they could safely reduce emergency department attendances and increase everybody's knowledge in the community for such a simple, common condition. So I think that it's really important that, I guess, that relationship where Healthier Together is actually like the glue between tertiary, primary healthcare, communities, schools, all these other things. You like being called the glue?
Do you know, I was reflecting on the name of our program just at the weekend. You know, as I said, we developed the program 12 years ago, and the focus was originally common illnesses in children, especially children aged under 5, because they make up a huge amount of primary care and ED activity. But increasingly, I recognise that almost the luck with which we chose the title of our program really reflects what we're trying to achieve. It's all about healthier together. I think both of those terms, this isn't about illness. This is about maintaining health. This is about advocating for prevention and early interventions. And together reflects entirely the integration and how we have to work with all of those extraordinary people that support children in our society.
I think that's really interesting, Sanjay, because taking the second part of the name of the program, so the Together, you've talked quite a bit about information going sort of from us as healthcare professionals out into the community. Do you have any mechanisms by which you're getting feedback from parents, from schools, from other people who are involved about what to develop, whether any content needs changing or updating?
So I think that's the key to the success of the program, actually, Christo. I think that it's only if people feel that this is their initiative do they buy into it. And so we've always called it, I think we've called it a social innovation. I can't even remember the term we've used on the website, but it's very much advocating for this is us working together to support our local community. And there are two bits to that. There's the local bit, because one could always perceive Healthier Together as a big national program. And the vision has never been to do that. You know, this has to reflect local services, and it's got to listen to local young people, local pregnant women, local parents, local professionals. And that's what we've strived to do throughout.
We went out to Sunderland Youth Group to do a design sprint because we have different parts of the website. So Sanjay's talked about the maternity and the child section, and we've got a young people section, but young people never look at websites. They just don't. And we were aware of this. So we developed this design sprint, and we went out to Sunderland, and we spent the whole day with Professor Greta de Fater and Professor Joyce Lee and a whole group of youngsters in Sunderland. And we asked them, how would you co-produce a young person section for Healthier Together? And it was absolutely amazing. It was gobsmacking. They had so many ideas. So I'll just give you a little bit of feedback. For example, they said, no, we don't look on websites. We only look on Instagram or TikTok. So you've got to get yourself a TikTok account. We actually think you should be Dr. M and that you should have like a weekly kind of like update where you just chat. They said, we just want 15 seconds of a little bite and then we might go towards that. The other thing that was interesting is they absolutely believe and trust the NHS. When they were asked, they all said they would go to an NHS website and they would look up health information there. And the NHS websites are really dry and I think quite complex. I think ours is much better. So there is a precedent. They will look for health information if they're signposted to it. But I am always completely gobsmacked by the way that young people actually have an enormous amount of energy and drive and real intelligence about how we design these things.
Do you know, I was going to reflect on something similar, but relating to professionals. I think if you give people the opportunity to be heard, and I think if you give people the opportunity to try things and to innovate, they don't cease to amaze me. I have trainees that write to me constantly saying, could we develop this page for the website? Could we do this project related to Healthier Together? And if you ask me, what am I most proud about Healthier Together, it wouldn't be that we've rolled out to half the country and that, the Royal College of Paediatrics is hugely advocating for it to be rolled out to the rest of the country. What I'm most proud of is it offers people a platform to be heard and to try new things, and it improves morale of staff. I think morale is single-handedly the most precious commodity that we have in health and social care and from our voluntary sector colleagues. And if this programme has any impact on morale, then that's what we should be most proud of.
I think that's so true, Sanjay. I think it's morale and it's listening, because there's no way one or two people can know everything. And it's the surprising, unusual things that people come up with. So, for example, we had the same experience. A trainee came up and said, I'm going to make some videos for you. I said, oh, that's great. What are they? They said, we're making videos for families of children that have tracheostomies or breathing tubes. When they fall out, how do you put them back in? When they get blocks, what do you do? It's really hard to read about that. You just need a video to show you what to do. That's what all the cooking shows everybody else does. So they're building an entire section on how to care for your tracheostomy tube, specifically for parents of children on this website. So, yeah, it's that listening to them, being open, hearing what people want to do.
So, Emma, your description of trainees developing that content, is so important. Is such an important part of the vision of the program, because so much of our work is about sharing good practice and not reinventing the wheel. And what we've achieved through having 15, 16 different Healthier Together sites is that we're all able to share the best stuff. And so I know that you and your colleagues have developed fabulous resources. You've done some of the work on testicular pain and in partnership with others. And we've unashamedly then taken that and put it on our website. Our colleagues from West Yorkshire have done some extraordinary work on neurodiversity. And just earlier, last week, I added that to our website. And I think that's what's brilliant about the programme, is that it allows us collectively across the country to share our talent and to listen to people and harness that energy so that it's shared at a really wide scale.
So I just wanted to ask Christo something. What's your favourite function on the Healthier Together website, project, platform?
I think practically the way that you can try and get the information on the pages to patients. So I suppose I'm thinking of two scenarios. One, when you're seeing a family in, say, Children's A&E, and you think there's some really good information, and rather than having to print it or use email or something like that, there's a simple button where you can text it to a family member's phone, they get a link. It's not linked to your mobile phone or to your email address at all. So it's kind of anonymous from the point of view of the practitioner. But I think more useful than that, or even more useful than that, is the kind of inbuilt translation, because I think that's one of the challenges when we're seeing families in A&E, and we know that these are the families, the ones where English isn't the first language, where we do them a disservice. It takes more of our time, and we miss things, and there is nuance that is lost. And I think if we can find a way of making that communication a bit easier, then I think everyone benefits from it.
Christo, you had 2 points, but they were both brilliant. So yeah, absolutely. The texting, there's a yellow button at the top. It's a yellow box. You press on it and it immediately sends a text of that page to the person in front of you. So first of all, you know they got it. They can't lose it. It's on their phone. And remember, every time you meet people, they only remember about 30% of what you've said. So, and that's if you're lucky. So yeah, I use that all the time. I think that's really important. Your second point was so important. I mean, one of our big drives is to be inclusive. So we have Recite Me on the website. So it will automatically translate and it will read out the information on the page. And I think this is vital because actually it's not that easy to read, and particularly when you're stressed. And we've also had a real drive to actually make it simpler. So we've started to include easy read pages because actually sometimes you need something really simple and you don't want all the detail. The national literacy level is around 8 years of age. You need to think about the Sun newspaper. And frankly, that's what you should be aiming at, that level of information. Because when you're stressed, when you're worried, you don't need to read too much. You just need to read the important things. Sanjay, I think we're almost at the end of the things I need to talk about. So Christo had his 2 favourite things. I'm going to give you, what are your 3 top tips for Healthier Together?
I think firstly, getting in your region. So I think advocacy is the first thing I'll suggest for all of you. I mean, many of you listening to this podcast will have Healthier Together in your region. As I said, it covers about half the country. We're trying hard nationally to find support to roll it out to every single ICS in the country. But I think there's a big difference between having the website and actually having an impact on families in your region. And that's why advocating for it, that's why using it, that's why sharing it with all of those colleagues across health and social care that support young people and finding a way to listen to them so it becomes your initiative, I think is the first bit. The second bit is probably something for the paediatricians listening on this webinar, in that we probably more so than ever need to advocate for families. I think that the financial crisis affecting this country has meant that more and more attention has moved towards the most costly bits of healthcare, which is often the frail and elderly, and has moved away from paediatrics. I find it harder now to advocate for children and young people than I have at any point in the last 12 years. And I do think that programs such as Healthier Together that are evidence-based, that are definitely grounded within frontline professionals, that have got a huge impact, not only on health and on urgent care activity, but on school attendance, on safeguarding, on addressing some of the social determinants of health. We need to advocate for that. And we do that by advocating with our local commissioners, nationally with NHS England, and above that. And some of the work we're doing is now advocating at a governmental level in partnership with the Department for Education, Department for Health and Social Care, Institute of Health Visiting, to really push the paediatric agenda. And I think we've all got a responsibility to do that. And thirdly, it's probably collect data. So in order to maintain buy-in and to continue innovating, we need data to show the impact. we're awash with data in the NHS, and yet we're so data poor in terms of the time and energy and access we have to those data. But I would really suggest that people try and get hold of that data and look at the impact of Healthier Together. Look at where your hotspots are for needing to address issues, and use your data to innovate. Use it as a way of working with your primary care colleagues, working with your voluntary sector colleagues, because actually the new models of care, which almost frontline clinicians have to drive. This isn't going to come from NHS England. This isn't going to come from people up there. That's going to come from us, people that desperately care about children and spend our days and lives looking after them. So use it as an opportunity to collaborate and to innovate and to bring about new models of care and new ways of working.
Amazing. I mean, obviously, this is kind of like preaching to the converted, but I think Healthier Together is incredible. It's evidence-based, it's easy to use, it's efficient, it's effective. And I think our message to you, to everybody, is use it, share it, personalize it, collect data for us and for everybody, and innovate with us. If you're not using it, if it's not in your region, just drop us a line. We absolutely want to spread it everywhere. If you are using it, fantastic. You're already one of our champions. So congratulations to you. And thank you very much, Sanjay. It was really lovely to see you on a Monday morning.
This podcast is a collaboration between Medisense Medical Education and the Royal College of Paediatrics and Child Health. You can find more creative learning resources on www.medisense.org.uk, and of course a wealth of information on the important work of RCPCH on rcpch.ac.uk or #ChoosePaediatrics.
The views, thoughts and opinions expressed in this podcast relate solely to the speaker and not necessarily to their employer, organisation, the Royal College of Paediatrics and Child Health, or any other group or individual.